Hello, YouTube family. I know it's been about a year since I last updated you on my interstitial cystitis. Um, as you can see, I have gained some weight. I found out that I do have hypothyroidism as well. So you get a combination of different immune system problems when you get this disease. Fibromyalgia is one. Having joint pain, weaknesses, different things like that. For the most part, I've been really facing spasms lately, really, really bad, like 3 times a day, where I'm like hunched down in a ball, and it hurts so bad, and it feels like a contraction. If any of you ladies out there have had a baby, you definitely know what I'm talking about. The pain is immense, and not knowing when it's going to stop is even worse. Mine usually lasts about 5 minutes, and it goes just like a contraction. It starts off slowly, then it builds, and then it comes back down, and then I finally get some relief. At those times, I don't want nobody to talk to me. I'm, panting. I can't catch my breath. It's a lot going on at that time. So it's just a horrible time. Me holding down a full-time job has been hard. I know I've lost at least 3 good jobs within the past 2 years. I was fortunate enough to finish my graduate degree, so I, thank the Lord for that. I did get over that hurdle, that obstacle, because there's many obstacles when you have IC, which is interstitial cystitis, for those who are watching for the first time. I decided to go natural, as you can see, because of that as well. Just for hormone imbalance issues and problems, and I find it that the perms are more likely to thin my hair, and they break my hair off more, and they don't give me length. And I've also found that natural, it's not natural, so it's not good for you, period. I also found that length-wise, since I've been letting it be natural, is longer. Right now, this is a 2-strand twist that I had took out today, but it's been blowing in the wind, so it's a little off the hook. You gotta excuse me. But anyway, so some things that I do to get through my IC is I try to read. Now that I'm done with school, I can read for leisure. I've been reading a new book, and it is called Lost and Found. This is the book right here by Sarah Jakes, which is T.D. Jakes' daughter. Her name is Sarah. This book right here, at first it wasn't really good in the beginning. I felt like, oh wow, I wasn't really reading it. But now I find myself reading it a lot, because I'm at the back of the book, as you can see. I'm almost done with the book. I did all these pages. I only have this left. So I'm really proud of myself for doing that. I'm getting more spiritual. I feel like that's helping me as well. Trying to keep focused and try to structure my day-to-day life as much as possible. But unfortunately, IC gets in the way of that as well. I might wake up one morning, I want to go walking. My IC might not let me go walking because I might be curled up in a ball, or my bladder is spasming, or I'm hurting, or I have to get on the phone with the doctor as soon as 9 a.m. hits to talk to a nurse because I gotta find out what I'm gonna do. I'm still doing my installations, which is lidocaine and heparin. And what I do is I use a catheter. I catheterize myself, or my husband usually helps me catheterize. And we put in medicine, which is lidocaine and heparin, which one of them is a beta blocker, and one of them, like, basically it numbs your bladder. I'm also on Elmeron. I've been on Elmeron since I've been diagnosed, which was in 2010. So it's 2014 now. So I've been living with this for 4 years. There is no cure for this. No cure. Yet. There are treatments, and depending on how severe your IC is going to detour or you from seeking treatment or having to seek treatment a lot. And I'm the type, I have to seek treatment a lot, unfortunately, especially when seasons change. I find out in the wintertime I'm better off because I guess the trees and stuff are dead and they're not pollinating. But when the summer's here and the spring, then and fall, that's when it all of a sudden goes crazy again. I have really bad flares. And what I'm talking about by flares is, it's basically when your IC is in remission, like just like cancer. You go into remission. You have cancer, you're experiencing these symptoms, and then all of a sudden they're gone away. And you think, oh, I don't have it anymore. But that's not the case. You're just in remission for the time, and then when it comes back for our IC patient, it's called a flare. So I have flares. My flares are urgency and frequency. I don't get no sleep at nighttime. I flies off the bed 3 to 5 times, if not more, during the night, flying off the bed to try to get to the bathroom because it's so bad, the urgency. I wouldn't wish this on anybody. I think the best treatment for this right now, because I've been through everything. I've had Botox injections. I've had hydrodistensions, endoscopy. I've had cytoscopy. I've had when they went in and they put medicine inside my bladder with steroids as well as antibiotics. I've had a lot of things, and I've had different opinions from other people. I see a women's specialist. I've seen 2 different urologists, and they all, to be honest, they all have something different to offer me. I just found a new thing, which I'm really happy about, because sometimes I'll be driving in the car and I'll just have a spasm all of a sudden. Well, of course, you can't just pull over, which I should pull over because it's that intense, but I usually don't. I keep driving. And just like a contraction, us mothers, us strong women, we can get through it. So what I usually do is I just keep driving, and it'll usually, go away. Don't know what the precursor of it is. When I'm saying precursor, I'm saying I don't know what causes it. What's coming before? What am I doing before it's happening? I have no idea what my precursor is. I've been trying to figure that out for 4 years now, and I still have yet to find that out. So that's a big thing. I do know that caffeine is one of the big things that causes flares for me. Different things that you eat. I stay away from pop totally now. I don't even want it, period. Because of the acid in it and the caffeine. It's basically just like just how they tell you if you have a battery and you can get the corrosion off the battery by pouring a Coke on the battery. That's the same thing that you're doing to my bladder. This is my bladder. and it has no covering, nothing surrounding it, no cavity to support anything that's going in. So when I pour a Coke on top of it, like the battery, what is it going to do? Ultimately, it's going to burn. It's going to burn on the inside like you've never ever felt before. I promise you. People will say, oh, it's like a UTI. Yeah, maybe it's something sort of like that, but it's worse than a UTI. And if you are a woman who have multiple UTIs, or in the past have had multiple UTIs, most likely you have IC. Because I remember at a young age, in my teenage years, I kept going back and forth to the doctor, and they kept saying, you have reoccurring UTIs. You keep having reoccurring UTIs. How do you have reoccurring UTIs when you're treating me with antibiotics? That doesn't make sense. So, here we are several years later, and because of technology and research, scientific research, they have now found this disease called IC, which is interstitial cystitis, previously known as painful bladder syndrome. Some people still call it painful bladder syndrome or PBS, but I call it interstitial cystitis because that's what I know it as. But it's a debilitating disease. You know, some days, I mean, from the outside, I can look perfectly fine. Because I know, like, right now you're looking at me like, oh, she looks fine. Her hair's probably a little messed up. But she looks perfectly fine. She's talking. She'll communicate with me well. But if I was in a flare right now, I wouldn't be talking to you. And I do want to make a video one day when I'm in a flare, so people out there can see what I go through, and others may be going through the same thing and they don't know what's going on with their body. So I just wanted to give you guys an update on that. I'm supposed to be getting a DMO, something like that, later on, another type of surgery in the next few weeks, so I'll update you on that. But for now, that's all. So you ladies out there, really sit and think about your past as a little girl in your teenage years and what you went through. You know, women things, womanly things down there, what you went through and what you're still going through now, if so. Also, endometriosis is a big part, because I did have endometriosis as well. They scraped off as much as possible. So sometimes you can have multiple things. You can have endometriosis and you can have interstitial cystitis. So if your doctor or you know that you have endometriosis, it's a pretty high chance that you probably have interstitial cystitis as well. So just letting everybody know out there. I just want to let everybody know. So until next time, I hope you enjoyed this video.